Alrighty, my name is Nicole Friedlich. I'm a fourth year medical student at Texas Christian University in Fort Worth, Texas, and I will be presenting on the research project that I am doing in conjunction with Dr. Shauna Combs, who is a pediatric adolescent gynecologist in the North Texas area, and Haley Dunlop, another medical student from the Ohio State University College of Medicine. Our project is called Just a Pinch, a national survey of provider attitudes regarding IUD analgesia management and options. So the reason we got involved in this project was something that we heard from our patients. We had been hearing, IUDs becoming more popular, wanting to talk about IUDs, wanting to talk about LARCs, long-active reversible contraception, and patients gave a variety of responses in regard to their experience in the office. Some of them, thought it was not a problem, very easy, very tolerated. And some patients, particularly those who had never given birth, were feeling a little more symptomatic when they would have their IUD insertions. Some of them would feel nauseated or, unexpectedly feeling a lot of pain and discomfort, and some could even not proceed. And from my experience in the clinic, I realized that there was this great variability in the toleration of this procedure, yet there wasn't any clear guideline as to how we could counsel patients about this pain or options about what we could provide for them. So we did some research, did some digging, and there wasn't a lot of reliable options for IUD insertions. There had been some methods that had been studied, but there wasn't a great consensus about it. We saw papers that talked about paracervical blocks and, using different dosages of lidocaine in these blocks. NSAIDs were a very popular option across the board, and some non-pharmaceutical agents such as music therapy and other distracting tools in the clinic were kind of variable from provider to provider. And we wanted to see if we could survey many, many providers across the nation, understand their experience, understand their training to see if maybe we could see what is the general consensus and where we can improve. So we ended up getting a great response to our survey, which we distributed through discussion boards on the ACOG website, social media, and about 700 responses that responded to our survey. Our survey was pretty lengthy, around 63 questions, and we asked them questions from their demographics, their training, and then what they prefer to offer patients who are nulliparous, meaning they've never given birth, versus multiparous, patients who have given birth before. And we found some interesting results. We saw that paracervical blocks were more popular than we had anticipated. And as we had anticipated, NSAIDs were by far the most popular choice for both nulliparous and multiparous patients. We were also pleasantly surprised to learn that music therapy was another option that was more commonly than we thought utilized in the office. And we also realized that there was some differences in practices regarding nulliparous versus multiparous patients for different demographics of the providers. Providers who had more than 30 years from the end of their training were more likely to give nulliparous versus multiparous patients NSAIDs, analgesics, and NSAIDs pre and post procedurally. And we also found that responders who identified as cisgender male were more likely to give had differences in their practices for nulliparous versus multiparous patients in after post-procedural NSAIDs. So we came to the conclusion that NSAIDs were by far and large the most commonly prescribed analgesic for both before the procedure and afterwards. And there was some variability with credentials, midwives versus physicians, the self-identified or self-reported gender identity of the responses of responders, and number of years after clinical training. And we determined that there needs to be more research, more guidelines, and just more conversation about what we can do for patients for IUD insertions, how we can make them more comfortable, how we can counsel them better on the different analgesia options, and kind of what the next steps look like. Recently, the CDC has not recommended misoprostol for these procedures and has recommended other alternatives to NSAIDs and pain management, such as the paracervical block. So it sounds like what we discovered has also been in the conversation in the community, which we are very happy about. And if that is the end of my presentation, if there are any questions or emails that need to be sent, these are great addresses to use. My personal email's on the top, and then the email of our PI is on the bottom. Thank you very much.